Welcome to another episode of Paramedic Playbook, the podcast where we delve into various paramedic protocols, providing detailed analysis and discussion for professional paramedics. Today's focus is on the Supraglottic Airway Medical Directive, an essential protocol in the paramedic's toolkit for managing airway emergencies. Under this directive, a primary care paramedic, PCP, may administer the specified treatment if they have the appropriate authorization. The primary indications for employing a supraglottic airway are the need for ventilatory assistance or airway control, particularly in situations where other airway management techniques have proven ineffective. This directive is crucial in emergency scenarios where rapid and effective airway management can be life-saving. Several conditions must be met for the supraglottic airway to be considered. There are no specific requirements for age, level of awareness, heart rate, respiratory rate, or systolic blood pressure. The key condition is the absence of a gag reflex, which is critical for the safe insertion of the supraglottic device. There are several contraindications for the use of a supraglottic airway. These include situations where the airway is obstructed by a foreign object, the presence of known esophageal diseases such as varices, trauma to the oropharynx, or a history of caustic ingestion. These conditions pose significant risks that can complicate the procedure and lead to adverse outcomes. When the conditions are met and contraindications are ruled out, the next step is the actual insertion of the supraglottic airway. It is important to note that the maximum number of insertion attempts is limited to 2. This restriction is in place to minimize trauma and potential complications associated with repeated attempts. Confirmation of proper placement of the supraglottic airway is a critical step. The primary method for confirmation is ETO2, waveform capnography. This technique provides real-time feedback on the patient's ventilatory status, ensuring that the airway is correctly placed and functioning. If waveform capnography is unavailable or malfunctioning, at least 2 secondary methods must be employed. These secondary methods include HCO2 with a non-waveform device, auscultation, and observing chest rise. An important clinical consideration is the definition of an attempt at supraglottic airway insertion. An attempt is characterized by the insertion of the airway device into the mouth, regardless of whether it is successfully positioned. Proper confirmation using ETO2, waveform capnography, is essential, but if this is not an option, relying on at least 2 secondary confirmation methods is imperative to ensure the airway's correct placement. In summary, the Supraglottic Airway Medical Directive provides clear guidelines for PCPs to follow when advanced airway management is necessary. By adhering to these protocols, paramedics can ensure that they provide the highest standard of care in critical situations, ultimately improving patient outcomes. Thank you for tuning in to Paramedic Playbook. Stay tuned for our next episode, where we will continue to explore more essential protocols and provide insights to enhance your practice as professional paramedics.